And there you go. The webinar is now being recorded. So just going to take a peek to see if, yeah, we've got 19 participants so far. We're right at 10 o'clock. And the number is bouncing up. That's fantastic. Okay. So welcome everyone to this morning's caregiver webinar. I'm Victoria Lougheed with Family Caregivers of BC, and I'm sitting in for my colleague Kate Landreth, who would normally be in my spot right now with the camera on me. I would like to welcome you to today's webinar and just have a brief introduction and housekeeping. So I'm just going to switch my screen over so that you can see my housekeeping notes. Just bear with me here. Okay. So I wanted to just point out and say a thank you to Ministry of Health Patients as Partners Initiative for allowing us to provide these caregiver webinar learning opportunities for our caregivers. Please ensure that you have a muted mic, your video is off, and we have enabled the Q&A feature as well as the chat. We've been having a few problems with chat in Zoom lately. So if you find you can't put a note into chat, please, by all means, put your note in the Q&A instead. I will be monitoring both. The chat feature is a bit wobbly, as I mentioned, so we just want to make sure that it all goes smoothly for you. So who are we at Family Caregivers of BC? We are here to provide support on a provincial level to caregivers across British Columbia. Family Caregivers of British Columbia is a nonprofit charity dedicated 100% to the well-being of family caregivers for over 30 years. We were the first of its kind in Canada, and currently there are only 3 provincial organizations at the level that we operate. Serving across BC since 2010, for the past number of years, we've been part of the Ministry of Health's Patients as Partners initiative. Our 3 pillars include support, education, and engagement. In support, we have a caregiver support line that's open 5 days a week, Monday to Friday, 8:30 to 4:30. It provides information, referrals, navigation, and support. We're an ear to hear caregiver concerns and offer caregiver coaching after an assessment of your needs. And we also have a fantastic caregiver resource center on our website that supports caregivers. Speaking of that, our education role, we provide webinars, articles, podcasts, and blogs on our website through the Caregiver Resource Center. We also have a quarterly newsletter, the Caregiver Connection, as well as a monthly e-news. We try to support group facilitator training so that caregivers across the province can receive support group type of intervention within their own community. We try to train the volunteers in communities so that each community can function on its own in the best way possible for caregivers. In terms of engagement and collaboration, we try to work with the ministry to improve health policy and improve healthcare quality. We provide presentations to stakeholders, caregivers across the province, and we participate in health committees. We try to focus on collaboration as well with condition-specific organizations, health authorities, and ministry personnel. In terms of next things, I would just like to provide a territorial acknowledgement. Each of us, myself, Cheryl Cameron, and Angus Campbell, when I introduce them, they will also do territorial acknowledgements. But for me and where I am humbled to be speaking to you as a settler from the unceded land of the Lekwungen and Saanich nations on Vancouver Island, who are part of the Coast Salish peoples. I want to acknowledge and thank these people, also known as the Songhees and Esquimalt First Nations, for allowing me to live and work on their unceded territory. Let us please take a moment to consider the impacts colonization has had on the First Peoples of this land. I encourage each of us to contribute to organizations committed to resolving disputed territories and learning from Indigenous communities about the costs of colonization. All right, I'm just going to move off of that now and on to today's presentation. We are going to be providing you a tour of Canadian Virtual Hospice online resources. We are also going to be featuring Proud, Prepared, and Protected for 2S LGBTQ+ caregivers, as well as some information about Canadian Virtual Hospice's online care hub, which is an amazing resource that I myself make use of as a caregiver. I can't speak highly enough about CareHub. So I'm just going to move through the next pieces and get us going on that. So we are going to be hosting folks from all across Canada. Cheryl is speaking to us from, I believe it's Ontario, and Angus is speaking to us from Nova Scotia. We're all across the country today. I was talking with Angus a little bit earlier, and he said that he's fine with questions during his part of the presentation. And Cheryl, I will leave it to you to let me know if you want questions in the moment or questions at the end. I will be monitoring and keeping track of those for both of you. So I'm just going to do a brief biography here. Angus Campbell recently retired as Executive Director from Caregivers Nova Scotia. He has been active in caregiving for many years. As you can see, he has lots and lots of involvement with caregiving, elder care, mental health support, dementia strategy, advisory work. He's just been all over caregiving for many years, and we are just so grateful to have his time and attention on this topic. As well, he worked with Canada Virtual Hospice to help them pull together Proud, Prepared, and Protected, and is a wonderful speaker on behalf of LGBTQ2+ caregivers. Cheryl Cameron is the Director of Operations with Canada Virtual Hospice. Across her career, she's held many leadership, strategic policy, program development, and education roles with a number of different levels and sectors, including post-secondary, government, and paramedical service. She's an advocate for paramedic integration into healthcare and currently supports numerous paramedic services across Canada to embed palliative care approaches into paramedicine. So learning objectives for today. By the end of the session, we hope participants will have learned about Proud, Prepared, and Protected resources for people who identify as 2S LGBTQ+ and or planning to or are accessing care. We also hope that you'll have an understanding of the Care Hub and how you can use it to simplify and make more fluid some of your caregiving challenges around organization and expense tracking, etc. Caregivers CAN and other grief support modules are also going to be discussed, and you'll be able to find those resources on the Canadian Virtual Hospice website. All right, I believe this is the point where I hand things over to you, Cheryl.
Thanks, Victoria, and thank you very much for inviting us to come present. My name is Cheryl Cameron. I'm actually joining from Alberta, and I respectfully acknowledge that I live and work in Treaty 6 territory, the traditional lands of the First Nations and Métis people. And we're really excited to be here to talk about some of the resources that can really be helpful for caregivers that Canadian Virtual Hospice has that are available and free. Just if anyone's not familiar with Canadian Virtual Hospice, we are the most comprehensive online resource in the world on living with advanced illness, palliative care, and grief. All of our resources are open, online, and free, and we manage quite a few different platforms, including the Care Hub, Caregivers CAN, which is a set of modules for caregivers, really practical supports and advice for caregiving, and a number of other platforms, which we'll talk about a little bit later. One of the key resources that a lot of people find really helpful that we have and has a lot of traction is our 10 myths about palliative care, which is really debunking some of the myths about palliative care and what palliative care is all really about. So I'm going to hand it over to Angus to really get into the set of resources that we're going to be talking about today, and we'll loop back to what else is available from Canadian Virtual Hospice at the end of the presentation.
Thank you, Cheryl. I'd like to begin by acknowledging that I'm in Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq people, so in Nova Scotia. So first of all, people have asked about the painting behind me. That's the Aspie Fault in Cape Breton. So, you know, first of all, Two-Spirit and LGBTQ+. Well, let's define that. You know, what is Two-Spirit and LGBTQ+? And we also see it as 2S LGBTQ+. So we're referring to people, my community, what I refer to as my community, because I'm a proud gay man. So Two-Spirit is for Indigenous people who may identify as gay or lesbian or bisexual and even trans or queer. And that's the other letters in here. Plus we include the plus sign because that refers to others who may be not quite yet defining themselves as such, or they may be somewhere in a spectrum of what their gender identity or sexuality is. So a little bit about this project, Proud, Prepared, and Protected. It is a collection of online resources. We're going to show you a bunch of those today. It came about because Canadian Virtual Hospice saw that there were gaps in available resources for people in my community. And so we thought, now how can we come about and do this? So we gathered a bunch of organizations, a bunch of individuals. Nearly everybody involved was a member of the community. Some of these members actually worked for community organizations. Some of the members were healthcare professionals. So we had a really good group of people to put together and discuss how we can go, what direction, what do we need to cover, etc. And we ran it by so many people as we were developing the resources, because we wanted to ensure that we included everyone or as many people as possible with these resources. So if you could just flip to the next slide, please.
You bet.
Thank you. So the first thing that we came up with was care conversation. And this one is planning for my care. And this is really about topics and questions to consider. And when we say conversations, you know, we have to start, first of all, with a conversation with ourselves. And then from there, conversations with our family, however we choose family, whether it's a family of choice or a biological family. You know, for those of us who have partners, you know, it's important to include them. For those who are single, it's important to define who is going to speak for you, you know, if you need assistance. And there's also things about maybe there's been partnerships that have ended but have not totally ended, they're not officially severed, and somebody may change their mind about who is speaking for them. So such as in the case of separation. So that's why we came up with this booklet, first of all, that people can talk, first of all, to themselves, then to a partner or other family member. And then finally, it's important to speak to your healthcare providers so that they know what you want. And this resource is a progression. So if we could go to the next slide, please. We included questions and topics that were not in standard advanced care planning or healthcare directives. So such as, you know, someone who may be on, you know, who's transitioning or transitioned and may be on hormone replacement therapy. So, you know, what do they want to do regarding that, right? Do they want it to be varied or stopped, or do they want to discuss it? given their current medical conditions, so if medical conditions change. And then as well, we give an opportunity further down that page to see sex assigned at birth. I doubt anyone has seen this in other resources, but we thought we would give people the opportunity to provide others and medical professionals, the full picture of their health and history. And this might be the safe place for them to do that. And speaking of safety and privacy, we added a section in here. Perhaps somebody has a preference to have a physical exam by a specific gender. And so that this would allow them to do that. We wanted to know if someone wishes to disclose this. This is, all these questions are optional, but what makes somebody feel unsafe? And also, well, what would help them feel safe? So each individual can express, what is working for them and what doesn't work for them. One thing that we're seeing more in advanced care planning and health directives, and we had added it here right away, because it unfortunately is more common than we wish to realize in our community, in my community, as to people to be contacted and people not to be contacted, or who's not to have access to personal information or to visit me. And I just want to briefly mention that I had my late partner. We had problems with his family. They even called the police on me twice. So there's lots there that we needed to give people the opportunity to say these things. Next slide, please. And sometimes the left side here, sometimes people are also caregivers that get sick. So it's an opportunity to list this information out there, including pets. We don't always see that. And then in section 6, we start talking about intimate care preferences. And it's preferred terms that people may want to use and terms that they don't want used. So this again is very much geared towards the trans community, but not exclusively. And how do people want to be bathed or to receive this intimate care? Is there a specific gender? Next page, please. So once we've had these conversations with ourselves, with our loved ones, how are we going to start getting this ready to put together that we can talk to our healthcare providers? And we can have those conversations ahead of time. But, now that we've made these decisions, how are we going to document them and write them down? And so we came up with this resource of my choices for safe and inclusive healthcare. We could go to the next page, please. And I know I'm going rather quickly, but I think it'd be best to get to your questions. Oh, I see. I'm just going to look here to see if any of those questions are for me. Okay, we have people making comments about the actual presentation. It is being recorded, so hopefully if you don't get it all here, you'll be able to watch it on the Family Caregivers of BC website. So these wishes for care, I just have to state this does not supersede a healthcare directive or an advanced care plan. It's just a good starting point that can be used to enhance one or as you develop one. And so we ask questions, if you were to get very sick, how much information would you want to be shared about your sexual orientation or gender identity? And how much detail would you yourself like to know about your illness? And so we just ask they're personal questions, but we give an opportunity for someone to think about them and answer them for their own benefit and also for their loved one. When somebody is not able to speak for themselves, if they do not have someone named to do that, such as in advanced care plan or a healthcare directive, then it can be a very messy situation. And especially within our community, if people are not married or have not been living common law for at least a year, then it can be difficult. So another thing that we did, if we could go on to the next slide, please. Is we created the Two-Spirit and LGBTQ+ Canadian Healthcare Bill of Rights. And so we know that the Charter of Rights and Freedoms in Canada does prohibit discrimination based on sexual orientation, gender identity, and gender expression. But what exactly does that mean? So if we could go to the next slide, please. We have created a one-pager. It's a little difficult to see, but the good news is that it's available on the website, and as well, we can include that in a package. We have a package of information we're going to send to everybody afterwards, but I have, oh, not that you can see it any bigger here, but I have it printed on one page. But it does explain things that, you know, you cannot be denied health care, and you have the right to receive respectful care. You know, you have the right, we all have a right to create an advanced care plan or a health directive. You know, it does, it outlines our wishes for future care and the right to have those wishes respected. So all of this is clearly laid out. We also have a little wallet size card if somebody wants to carry this with them in case they go to a healthcare professional and they're denied service. And we have heard about people being denied service. And if I just want to get to some of the articles that we have on the website. The next slide, sorry. So these articles are both for members of the community, and you don't have to be a caregiver for these to be relevant to you. These are for members of the community. These are also for members of the community who are caregivers, and these are also for healthcare professionals. So, you know, why does inclusivity matter? Well, that's a great article for healthcare professionals that they can see, whoa, yes, maybe they could change their way of doing certain things or considering certain things that they can serve their people better. But on the other side of that is, how does somebody in my community find inclusive care? And so we have some good examples there and explanations, and which leads into getting the care that you need. So these are just some of the topics that are there for us to see. For you to see, I would like to suggest you look at the third column, the top of the third column, for the healthcare professionals and others who may not know this, but we've come up with a document on how to be an ally to someone who is in my community. Because many people hear the term ally, but what does it mean? You know, how does one do this? So we've got some really good suggestions along those lines. I'm just going to check here to see if well, you'd let me know if there's any questions, won't you, Victoria? So the next slide, please. Besides all these print resources, we have a number of videos, and whether they're about here and the ones that we're showing about exploring what end of life might be like for someone who identifies as LGBTQ+, you know, or in the top right, we have someone who understands that it takes time for people to adjust to using certain pronouns. And so that's another interesting one to listen to. I think they're all quite interesting because all these different points of view are coming across. And one of the things that we're taking a look at aging in the population, and specifically to my community, Social isolation. How is it different, or is it different? But I can tell you it can be different for people in my community as they're aging. There's some really good videos to watch. They're not very long, and I highly recommend that you take a look at them. As I said earlier, we are going to hand out a package of things. One is the popular resources. Again, you're not going to be able to see it, but it's a 2-pager of the popular resources from Proud, Prepared, and Protected. And by the way, the title of Proud, Prepared, and Protected I came up with because I just felt it was really important, that everybody in our community be proud of who we are and be prepared for what may come our way, especially with challenges, possibly from the healthcare community, but also from families and friends of your loved one, that we really are, we get that together such that we can be protected and do things our way. And the next slide, please. I just want to briefly touch on mygrief.ca. And this looks at grief in my community. And, we know that you can see for chapter 2, hopefully you can see it, how discrimination and oppression can impact grief. Well, we're very familiar with the AIDS epidemic. There's a whole gap of primarily gay men who are missing, who died far too young. And so I've known hundreds, I'm sad to say. And so we have that, and that some of that grief is still ongoing. It lingers. It can be if the late President Ronald Reagan had only done something when he was asked to, rather than ignoring the whole situation, we would have had years of research and we could have stopped this situation far earlier. The same thing can be said about women's health. Women's health research has lagged behind men's health research for, decades, centuries. So, we need to keep this in mind, that therefore all women, including lesbians, have not had the same advantage that men has had in research. So, this is part of grieving. And then as well, chapter 3 talks about trauma and grief in my community. Well, there's potentially limited support. And so we need to recognize that right away as the first thing, recognize it and see if there are ways that we can change that. It's one thing when we're in cities, we seem to have more supports and more resources available to us. But when I think of people who live in rural parts of the country, let alone in remote areas of the country, what are they going through? What is available to them? And so now we see with Zoom and the internet and so many things have improved that way. But are we actually doing things to help them? So I think it's really important to do that. And if we take a look at this module of mygrief.ca, I think that you're going to find some things that are quite helpful. This is all at your pace as you go through it, correct? So, and then one more slide, please. And so CVH, Canadian Virtual Hospice, has a number of resources for caregivers. And I'm very proud to report that I was part of all these projects. So I'm going to let I'm going to let Cheryl speak to them. I just, in closing, I wanted to let you know that, I was a caregiver to my late partner. I wish we had these resources when I was caregiving. It would have made things so much easier. when I talk to somebody about getting some support for me, which we all know is the biggest challenge for caregivers, but getting some support for me, I was told to go to the Alzheimer's Society, and the Alzheimer's Society does great work. Don't misinterpret this. They do great work. Well, I partly did not have Alzheimer's. So it was, it was like, well, what are we going to do? Where are we going to go? So nobody referred me to Caregivers Nova Scotia. So I'm really, really happy to be part of this. I hope you make use of these. I hope you are able to pass along this information to others, be they caregivers or not, and all people within the 2S LGBTQ plus community. And so, Cheryl, I'm going to turn it over to you, if I may, please.
Thanks, Angus. So yes, I'm going to take everybody on a little tour, and it's going to be kind of a whirlwind of the other resources that we have that might be of interest to caregivers, and then also some other interests that resources that might be of interest to you from Canadian Virtual Hospice. And I see that there's been quite a bit of chatter in the questions around the web links and where to find these resources. And so we're going to be sending out, as Angus talked about, a PDF that has the links to all those resources. Also, if you visit virtualhospice.ca, all of these other platforms and resources are listed there under featured services, and will take you directly to each independent website that has those various different resources. So we're going to start off featuring a couple that are specific for caregivers, and then I'll give you a little bit more of a highlight of some other things that are there that might interest you. So next slide. So the first one we're going to talk about, and Victoria alluded a little bit to this platform, is the CareHub. And so the CareHub is actually an online tool to help coordinate caregiving activities. So it has quite a few different features that you can choose to use or not use depending on what's suiting your needs at various times. There is a health tracker to be able to track symptoms, which is based on the ESAS palliative care scale. There's also a set of questions in there related to the Canadian problem checklist. And the health tracker allows you to kind of monitor symptoms. As you're tracking symptoms, there is a clinical information loop that will punch resources into a library. So if you are tracking pain, for example, as a symptom, resources around pain will populate into your library that you can then peruse at your leisure. It also offers little helpful tips when you click on different things tracking your symptoms, and you can look at reports. So definitely longitudinally, how is your pain being managed, for example, being able to have conversations with your healthcare providers around what's been going on over the last 2 or 3 weeks, maybe since your last visit. You're able to track those symptoms and take a look at a longitudinal report to really aid in that communication of information between yourself and care providers. As I mentioned, there's the library, and so the library populates resources based on kind of some of the information that you put into the CareHub. And so there are a number of different questionnaires that you can choose to participate in. Especially on the caregiving side, there's questionnaires around your readiness for caregiving, how comfortable you feel with caregiving tasks, and then different resources will populate in your library based on those examples. There's also a medication tracker where you can track medications and make updates to a medication list. You can keep a full-fledged long-running medication list, and you can view or hide different medications if some have been discontinued, but you want to still keep a longitudinal list. There's an expense tracker to be able to keep track of expenses with caregiving. So this is one place that definitely we hear from caregivers is a really onerous task when it comes to keeping track of the different expenses, the fact that you can claim some of those through different benefits packages. This is one way to kind of hopefully decrease the burden of that task, a place to put that information so that it's easier to compile at tax time. There's also a calendar to be able to book appointments and keep track of appointments. There's a journal, and we see the journal being used in a couple different ways. One of the cases where we see there being really good use of the journal is kind of keeping that running list of things that might come up that you might want to talk to your healthcare providers or your physician about. We know that not everyone gets a lot of time with their physician. You might have a 10-minute appointment, and sometimes it can be really hard to prioritize what's the most important. And so kind of keeping a track of things that have been coming up over the last couple of weeks, having that in one place to be able to decide what's most important, we think is a good use of the journal. One of the key features of CareHub is actually that it has shared access. So there is the ability for you as a caregiver to create an account and then also to link accounts to the person you might be providing care for and having kind of a single source of truth. A couple of the different use cases we've seen people using it for is you might have someone who there's other people in the family who are also potentially providing care, but maybe not daily, but need to be up to date on kind of what's going on and may or may not be living in the same house or might be at a distance. And so there is opportunity to provide either, view only access or access where they can engage with the CareHub as well, so that anyone who's in that broader circle of care can have access to this single source of truth. Next slide. So really, what are the benefits of CareHub? You can track those symptoms, well-being concerns, and CareHub will synthesize those reports so you can share with healthcare providers. It does populate a personal library of resources that are selected to the needs that you've identified, helps you prepare for health visits and share that information easily, organize medications, healthcare costs. You can access a list of programs and services. So embedded within the library is a listing of all local programs and services that has been tied into Canadian Virtual Hospice's larger repository of programs and services. And so you can search in there based on postal code or radius, anywhere from 50 kilometers up to 250 kilometers geographically. You can search for a list of services, and then they're categorized into different topics like companionship, grief resources, palliative care resources, and those kind of things. And as I mentioned, you can share information with the people you choose. So you can add other people to your CareHub, decide what kind of access they get, whether that's read-only access, or if they can write in it. You can decide which of those different tools you want other people to be able to have access to see or not. So that's all up to you. This was developed with Caregivers and is fully free. So you can check to the next slide. We've just come out of a pilot phase actually with the CareHub. And so we're really privileged to actually have some feedback from people that have been using the CareHub. And what we really heard from people is that it wasn't easy sign up. Things were kind of right there on the page. It was really inviting and engaging. And the integration of videos and other information were things that were helpful, but not necessarily something that you would know to seek out on your own in like a Google search or where to find those things. Really easy navigation back and forth and lots of invaluable information throughout the site. People really liked the opportunity to customize that CareHub. There is a piece around being able to identify if you want notifications for different pieces of the CareHub. So like a notification to remind you to track symptoms or to update your medication tracker. And then it really is kind of one of these self-serve resources. So you can use it when it works for you in your own time. If you've got 2 minutes to go in there and track symptoms now, but then you want to read an article later, it's all kind of there at your own pace and time. And one of the really salient pieces that we've really had the privilege to hear is about people who have been reflecting on their own caregiving experience and the way that this tool might have been helpful in the past or could potentially be helpful in the future. So next slide. So other than CareHub, we also have a set of caregiving modules, and these were launched last year. And they're on the website called Caregivers CAN, which is really about supporting that confident, compassionate care. And so there are a set of 9 really practical modules there to kind of help support people who are new into their caregiving journey. They include strategies for having difficult conversations. We know that when people who you really care about are starting their journey with a serious illness, there can be a lot of difficult conversations that need to be had. And so there's strategies in there for that. Video demonstrations of caregiving tasks. So a lot of those personal kind of tasks or patient movement tasks, there's video demonstrations of how to do those kind of pieces safely in a home environment where we know that you don't necessarily have the same kind of aids and supports that you might see in a hospital. Guidance for kind of recognizing and managing the most common symptoms that will start to occur or potentially start to occur in advancing illness. Suggestions for accessing different programs and resources, and also ways to care for yourself as a caregiver. Next slide. So those were the main resources that were kind of focused on that role of a caregiver. But from Canadian Virtual Hospice, there's lots of other resources that are probably going to be relevant across that caregiving journey. And so mygrief.ca that Angus referred to is, again, an open set of free resources that is there to help you understand grief and start to live with that grief experience. Again, it's in your own place at your own pace. It's set up in different modules. It's developed by people who have been there and grief specialists. So you'll hear throughout the modules lots of embedded stories of people with lived experience and their own grief experiences. Features those real life stories and experiences, and is also a really key resource for professionals. So we do see this resource, it's one of our most popular resources. It is one that's referred a lot of times for patients and people living with illness and caregivers from healthcare providers. So we really encourage you to check that out if you haven't had a chance to go there. And as Angus mentioned, there is a module specifically on mygrief.ca looking at the context of grief in the 2S LGBTQ community. There's also other contextual modules that were just launched last year. So there's additional modules on, for example, the loss of someone important to you by suicide, the loss of the loss that you experience when you're caring for someone who's potentially going through a degenerative neurological disease, the loss of a spouse or partner. So there's quite a few other contextual modules there that might be of interest. We also have kidsgrief.ca, which is a support really for parents who need to figure out how they're going to help support children in their life with grief. And so lots of information there about how to talk to kids and teens about serious illness, dying, and death. Of note, there's also a set of resources there that are specifically directed at educators. So there's a set of modules for parents and then also for teachers and educators. For families who are currently caring for an ill child, caringtogether.life is a set of resources that is really designed to educate, support, and empower patients that are caring for seriously ill children and who are experiencing pregnancy or infant loss. So that site is there as well. And then we also have a set of publicly available resources around medical assistance in dying. And so we know that there's sometimes gaps out there to access to non-advocacy, just fact-based information around medical assistance in dying. And so a set of resources have been created there in collaboration with all the provinces, and there's programs and services references there for specific provincial information, but that resource is really focusing on the psychosocial support pieces around the discussions around someone who might be interested in medical assistance in dying and what that looks like. There's a lot of different articles there and videos as well that may be of interest. Next slide. So lastly, I just also wanted to highlight Living My Culture, which really has been referred to as kind of the Netflix of palliative care. And this platform really includes a lot of lived experiences from people from 11 different cultures, including our First Nations, Métis, and Inuit populations, speaking about death and death ceremonies and grief and those contextual features. So there's a lot of additional information there in the form of videos that might be of interest. So I'm going to stop talking. We can go to the last slide. As was mentioned, we will have these slides will be circulated, and we'll also circulate a PDF that has the links to all of these different sites. Everything that you saw today is totally free, open, and accessible online. The only one of those resources that requires any kind of login is the CareHub, just because you are it's a secure environment for you, so there is a login for that, but none of the other resources you're required to give any kind of information, email address, a login, or anything like that. So I'll stop talking and we can maybe address some questions.
Okay, fantastic. A couple of questions have come up. Pat noted that they were curious about whether there's an expectation or a hope coming from this webinar that caregivers themselves would be able to share this information in different areas or venues. I absolutely encourage that. I'm not gonna discourage you at all from sharing that. I also agree, Pat, that I hope this gets to the caregiver training for paid caregivers courses. You're absolutely right. It would be wonderful to have all of these wonderful resources included in training going forward. Victoria asks, how can we get access to CareHub? She apparently reports having trouble finding it on the website. Happy to walk you through that if you'd like. I believe you go to virtualhospice.ca. And then I know it's on here somewhere. Can you help me out, Cheryl? Point me where to click? Because I joined right away.
Just because we're just coming out of our pilot phase and we haven't done our huge public launch yet. It's not yet front and center on our website, but if you want to scroll down to the Caregivers CAN site. Yeah. And then it'll be thumbnailed on the right-hand side. So just so everyone's aware, we are coming out of a pilot. So the site is live. So you can use it, you can get on there. There isn't, I think another question here is asking about needing help with the expense tracker and the medication tracker and registration.
Yeah.
There is a, once you get into the CareHub or even on the landing page, there is a contact us. So you can reach out and email me, and then we can set up whatever will work best for you for us to get on a live Zoom or whatever that looks like to help with support. So we're definitely willing to do that. So the website is www.carehub.life, but you can get to it kind of now through Caregivers CAN. We're just wrapping up kind of the feedback that we got from our pilot and doing some improvements and minor tweaks. And then we will be pushing it out a little bit more aggressively live and spreading the word a little bit more. So you guys are kind of like a sneak peek post-pilot group that also gets awareness that it's out there. You are more than welcome to share it with other people. We just haven't done our big like promotional communications launch activity yet, but it is live and it will stay live. So even though in the pilot, it's not like we're taking it down or anything like that. You just might see that there might be a little bit of tweaks going on as you're in there, as we make some of those kind of final improvements before we push it out for public launch.
Okay, fantastic. I wanted to ask just a little bit about being able to give people access to share the hub and have other people sort of participating in the hub. Has that been used much?
Oh, you mean?
Go ahead, Angus, the linking of accounts.
Yeah, you mean so one care recipient with, let's say, 3 caregivers?
Yeah.
Oh, okay. Well, that would be my situation. So, you know, I have an 85-year-old friend and she is in a care facility. I'm her primary caregiver, but my brother-in-law and my partner also participate in supporting her. So we use CareHub for all of our appointments, and when we make notes, and everybody can see what's going on with one another.
Oh, that's fantastic. So this would allow, for example, not long distance caregivers as part of the caregiving team to be up to date and know what's going on with a care recipient that they're supporting from far away, where others might be doing some of those hands-on tasks, but they can still see into things. Absolutely,
because we know that is, it's kind of like, you know, having a telephone tree, right? Yeah. So when something happens, rather than one person having to phone all these different people and telling the same story over and over again, it's an opportunity for somebody to document it, that it's there for the future, for future reference, but at the same time, other people can read it and know what's going on. Very good, especially for people in different time zones.
Right. Yeah. Another, and again, this is one of those pieces where I'm using it now, but I wish this had been around when my daughter was doing her early intervention support for her autism when she was between 4 and 6, because at that point she had appointments every day of the week for a year. We were seeing different specialists, and there were 3 of us coordinating, you know, who was going to pick her up, who was going to drop her off, who was going to be where, when. And I wrangled a Google Calendar, but it got really complicated and there were always pieces missing. So boy, I'm really glad this exists now.
Yes, and I have to tell you, one way that I've use the calendar function is to mark when home care has not shown up. Because we were paying for some private home care, or Alice is paying for some private home care. My brother-in-law handles the finances, but they wouldn't show up. And yet the home care agencies, some of them were billing for absences. And so this way we were able to say, no, you did not show up on this date. So.
Wow. Yeah. And it's good. It really does help you track everything. It even helps you track some of those hidden expenses that caregivers often speak with us about. Everything from extra groceries to parking costs, to some of the more, difficult things like, you're maybe paying out of pocket for a service because you're on too long a wait list. And it just helps you keep track of where your money's going as a caregiver. It seems to kind of fall through my fingers.
Yeah.
Great. Are there any other questions coming through from the group? I'm seeing lots.
There are a couple there, Victoria, that I just answered.
Fantastic.
Just them, but maybe I'll just verbalize them in case anyone has the same question. So one was wondering about using CareHub on phone. She might use it on the phone and her mom might use it on a computer. Is it possible to share across different devices? 100%. We're still optimizing the mobile view, the portrait mobile view, but right now it's built as a website, so you can access it on any different device.
So through a browser.
Log in through a browser. Yep. Website, we'll make sure we send it out as well, www.carehub.life. And then Helen was asking if she could use the caregiver resources in her caregiver groups. And that's what we're hoping for is, right, these resources are adopted and used and fleshed out and shared as much as possible. So please do use the resources. That's what they're there for. They're open and free access. If you are doing that, it would be of great help if you could just shoot us an email and let us know that you are, because we do keep track of kind of like where our resources have been adopted just for like funding reporting and things like that. So it would just be awesome if you are adopting them, if you could just shoot us a quick email and let us know, just so we can keep track of that. And often those adoption pieces, people pulling up those resources, starting to use them is how we learn about your organization, and lots of times future partnerships on other pieces of work come out of that too. So please feel free to like directly engage with us as well about your thoughts on the resources. Especially the caregiving modules, there's a kind of little feedback quiz at the end of each, and we're really looking for feedback. And so a lot of our products are always kind of in this version of refreshing too. So if people have any suggestions or saying, wow, I wish this was here, or, this piece didn't really reflect my experience, I'm wondering about this, just please like provide us that feedback so we can continue to keep the resources fresh and responsive to people's needs.
Fantastic. I see Sandra here is also asking, is it all right to share with the Parkinson's Society of BC? Absolutely, please do. Yeah. Angus, I have a question for you around Proud, Prepared, and Protected. I've got a friend whose dad is now partnered with a lovely man. My friend's dad is starting to move into dementia, and throughout his career, in the kind of work he did, it was absolutely not okay to be an out gay man. And so he has so much reluctance around his identity and letting people know. Is there anything in Proud, Prepared, and Protected that we can share with him to help him feel more comfortable?
Very good question. Coming out is a very personal journey. And not everyone will. And, so some of us, I came out at 18. According to one of my cousins, it was 13. But, well, she knew, I didn't. But,
Fair enough.
It's such a personal experience. So I don't think we have anything in there about helping people to come out. But I think, and there's definitely can be a very different mindset from, I'm 64 years old. So, people who are 20, well, even 10, 20, 30 years older have a totally different experience. And so, I would recognize that with that gentleman. And it's just, you know, what does he feel comfortable with? You know, one of the things is, is he still able to be able to create an advanced care plan or a health directive that he's going to be looked after by the person he wants to look after him, you know, in the way that he wants to be looked after. So in that sense, yes, there's information in there for someone to look at, and especially for his partner to look at.
Yeah.
So yes, in that sense, but you know, when it comes to coming out, it's very personal and private.
Okay, thank you so much for that, Angus.
I see somebody's asking, a relative in Miami, and so can the US access this? No fee for anybody. And yes, you can access it if you have a computer anywhere in the world. Now, not everything will be relevant, such as the Canadian Healthcare Bill of Rights. It's not the same in the States. And we know that here in Canada, we have many more federal laws for things, whereas in the States, they do so much more by the state. So things will not necessarily be the same. But I think a lot of the flavor of it is very much the same.
Fantastic. We're closing in on 11. I would just like to say to anyone who's got a question, pop it into the Q&A in the next moment or two, and we'll be able to fit it in. But in the meantime, I just want to restate that this webinar is being recorded. It will be made available on our website. We will be sending out a link to the recorded webinar along with a survey in the next day or so. It does take us a minute to do the editing, get it up onto YouTube, stuff and things. But it will be made available to everyone, and we will connect with Cheryl and Angus around a package of resources that will be included. That will go to everyone who registered, whether they attended or not. So everyone will get to share the resources. And if you have any questions about the resources and don't remember who was who or how to connect with Cheryl, that's fine. Call our CSL line and we will get you connected to the right people to support that. Okay, so we've got another question here from Jess. How many years has this program existed, I think, since inception? Now, I'm not sure if he or she is asking about Proud, Prepared, and Protected or CareHub, so maybe we'll answer both.
Well, okay, I started as Executive Director of Caregivers Nova Scotia in 2012, and I met Shelley, who's the Executive Director of Canadian Virtual Hospice, I think in 2014. But it's been around, for at least 10 years before that. So Cheryl, do you know?
I was literally just going to look up our about page because I'm newer to Canadian Virtual Hospice as well. But Canadian Virtual Hospice has been around for quite a while. The 2S LGBTQ resources were part of a larger granted Health Canada grant that we'd been working on pre-COVID, that everything was delayed during COVID. So those resources started rolling out in the fall of 2021, I think, right, Angus, was when we had launched those resources. Yeah. And then as far as the CareHub, same thing. CareHub is part of a bigger grant-funded project, primarily funded by Infoway, Canada Health Infoway, started pre-COVID and just went out for pilot in the fall here. So it was made, in April of last year. The pilot started, wrapped up at the end of October. So it's been live since about April 1st of last year. So CareHub is definitely new. And like I said, not yet really publicly launched yet. So it's kind of not out there yet, but.
I remember attending my first CareHub meeting. It was in 2018, I think. So that's when it all started.
it's a testament to, I think, some of the process in the way that we develop projects too, with the engagement with people in the population and embedding lived experiences. It takes a lot of time to do that engagement and to also build products that are reflective. And so we see that our projects take a while, definitely, but it really comes out in the quality, I think, around them being really built by and for the community.
Okay. Well, thank you, everyone. Thank you, Cheryl, and thank you, Angus, for the time you've taken today to share your knowledge and expertise with us. I know you're both busy, so every moment you took for us was really greatly appreciated. Thank you to all the participants who were able to attend today. And I just want to restate that the recorded webinar link, as well as a survey, as well as resources, will be sent to everyone who registered and will be available on our website as a webinar and extra resources. So thank you so much, everyone. It's been an absolute pleasure hosting you today. Take care.
Thank you.